So welcome back for the second video of activity management. Hopefully you've all seen the first video where we talked about the activity analysis and traffic light system. I asked you to have a list, make a list, and just colour code some of your regular activities with red, amber and green. It's important not to forget that as well as being physically demanding, you can also relate the traffic light system to tasks that are emotionally and also fatigue demanding. However, if you still can't pinpoint aggravating tasks, don't worry. It may be worth trying to pace certain activities, just a couple of activities, and see if that makes a difference. It's also helpful to try keeping a diary. So even for 2 weeks, you have a go at noting down what you're doing and how your pain is and how you're feeling, and then being able to look back over a couple of weeks and see if you can see a relationship. It might be that on some days you go for a big shop and then it's not until 2 days later that you're feeling not so good and you have increased pain. So it allows you to sort of recognise relationships a little bit more broadly. So how do I pace? So firstly, decide what you're going to change first. And this links in really well with your long and short-term valued-based goals. So what is it that you value most and what do you want to focus on first? What is your priority? It can feel quite overwhelming at first, where to start. So goals are usually a good way to start. And actually, by making a few changes, you may find that there are benefits with other things. Then find your baseline. So explore what is a manageable amount. And try to measure this in some way. So using time, distance, repetition, and for example, with reading a book, it might be how many pages you read each night. If you enjoy knitting, it might be how many squares or how many rows you may knit. If you're a swimmer, it may be how many lengths. It may be, though, that this amount does change. It may be a bit less or more on certain days. So pacing is about planning. It's about planning really well. So people do find it helpful to maybe have a weekly planner, keeping a diary and to write a to-do list. And then by using the traffic light system, you can colour code certain activities that you're doing that week with red, amber, green. And then it gives you a good idea, how many reds and how many ambers you're doing. Avoid putting these all together, all on Monday morning. Try not to do all of your reds and ambers for the week. Spread them out over the week. And then make sure you've got lots of green tasks in there. Get into a habit of breaking tasks down and start with your red and amber activities. Try and find what is a manageable amount. And what I would do is cut it down by 20% by what you think you might be able to do. So going back to what is a manageable amount, it might be that if you feel actually you can stand for 10 minutes, as a starting point, break that down a bit more by 20%. So maybe just start by standing up for 8-minute chunks and plan to stand for 8 minutes. Consider other ways of doing the less important things. So for me, I have no interest in shopping and going around a shop. So I like and I enjoy doing my shopping online. However, if actually shopping and going around the shops is important to you, then that will be something to prioritise. Become more confident in what is a manageable amount. So having a better understanding in what is manageable for you allows you and perhaps makes you more confident in saying no to others and saying no to taking more things on or doing more. Have a think that does this task need to be done now? How important is it? Will it be okay? Is it okay to leave it to the next day or the next week? One thing with pacing is it really helps identify the priorities and what is important. So therefore, if it's not that important, it's much easier to move it back, move it to the week after. So organise the task and environment to perhaps make things easier, and changing the position regularly. So those that may sort of be fidgety and fidget lots, actually that is a pacing technique. Actually moving regularly may be helpful for you. It might be that actually doing a standing task and varying the height that you're working at actually allows you to stand for longer. So that's one tip, maybe have a go at changing your position regularly. So again, it might be that you don't have to stop completely and break and rest. It may be that you can just alter your position and keep going for a bit longer. So a lot of people ask, how can they increase their activity levels and baseline? So once you've found what you think is your baseline and a manageable amount, and remember we said about starting 20% less than what you think you might be able to do. It's then about creating a plan to gradually increase your activity levels. And I quite like this drawing here that shows your protect by pain mechanism. So a body's protect by pain system, is designed to make sure you don't damage yourself. So on the left-hand side here, you can see that the protect by pain mechanism is lower than the tissue tolerance level. So the protect by pain mechanism kicks in just before you're at that risk of injuring yourself. However, with chronic pain, this system is working too well. And unhelpfully, it actually lowers. So on the right-hand side of the picture, you can see that there is a new protect by pain level, and it's a lot lower than your tissue tolerance. So this can be unhelpful because you may be doing a certain activity and this protect by pain mechanism comes in a lot sooner than it would normally. However, it's reassuring that actually it's a long way from the new tissue tolerance. So it may be that it's a little bit sore when you do an activity, but actually doing a little bit more is okay, as long as it doesn't create and cause a flare-up after the activity or the day after. By setting a baseline, a new baseline, and then gradually increasing activity levels and fitness, it can help reset your normal protect by pain system. This does take time, and rushing it will reinforce the danger signals. So I know when we talk to you about setting goals, we do set long-term goals. It is about making gradual changes. So just to sort of finish off, it's just thinking about some other techniques. So again, start with what is most important to you and link to your short-term goals. Tasks that you have identified as red or amber may be associated with an element of danger and fear. So it may be useful to discuss any of these concerns that you have with your key therapist and checking that they're the right things to do. And make a plan to do even a small amount of these tasks in a manageable way and a safe way. And this can start to ease and relax the pain system. And over time, by repeating this, you can begin to manage more of the activity while still managing your pain. So actually repeating the task regularly is helpful. Doing little and often of the task is helpful. So breaking it down and doing little and often can again help reassure and reset that pain system. Plan in plenty of rests, and this may also be relaxation techniques and green activities. Try alternating tasks. So like I said before, it may be that it's just a break from the challenging task. Also have a first aid plan for a not so good day. So it's hard to completely avoid these not so good days, but have a plan in place that if you do have a bad day, what you can do. So think about what tasks you can still do, and these fit well with your green activities. So it might be, for example, gentle stretches, relaxation, and doing something that you enjoy. If you find that actually you really struggle to identify green activities, it might be about going and exploring and finding some more activities that would be green. It might be that you just need to return and have a think about what may have caused this flare-up, and reflecting on that, and maybe thinking about, do I need to just go back to the last baseline that I did and take things back a little bit more. So hopefully that gives you a few ideas to start with, thinking about your activity analysis and then thinking about planning and making some small changes. If you have any questions, do speak to your key therapist, and hopefully they can go through some examples, specific examples of how you can start implementing some pacing techniques. Thank you.